Welcome to the Vision Eye Institute Clinic in Bondi, Junction, where we've been performing laser vision correction for nearly 2 decades. Our work is extremely rewarding as we help people reduce their dependence on glasses or contact lenses or getting rid of them altogether. To date, over 6 million people have had a laser vision correction procedure. Here at our clinic, thousands of people are now enjoying the freedom that comes with laser eye surgery. Before you commit to surgery, it's our duty to provide you with a full range of information, including potential risks and complications, so that you can make a fully informed choice regarding your procedure. There are 3 different vision correction procedures that are used worldwide today. LASIK is the most commonly performed surgery. It involves creating a flap in the top layer of the cornea and folding it back to allow access to the layer of the cornea that requires reshaping. The flap is then folded back and should heal on its own. ASLA, also called PRK, is the oldest form of laser vision correction. This involves applying the laser to the top layer of the eye. The latest form of eye surgery is called SMILE. It stands for Small Incision Lenticular Extraction, and what it means is that we are able to do the vision correction like LASIK without having to make a flap. This minimally invasive procedure is in essence keyhole surgery. The benefit of that is that the surface of the eye is left in a more natural state. There is less impact on dry eye, and it also leaves the cornea stronger. If you feel you have any more questions about the procedure that is recommended for you, feel free to ask anyone here at the clinic. You'll need to take a day off and have someone accompany you to our clinic, particularly to ensure that you get home safely. Before your treatment, you'll need to complete a procedure consent form. Payment will also be made at this time. Ask our receptionist about payment options, including interest-free payment plans. Once the paperwork is done, we'll start to prepare you for the procedure. One of our clinical staff will take you through each step of the procedure. You'll be offered a mild relaxant and anesthetic drops will be placed into your eyes. The procedure itself is quick. You may feel a slight sensation of something moving in your eye and see bright lights, but it would be very unusual if you feel anything more than that. Once your procedure is finished, you'll be taken out to our recovery room where our staff will check your eyes and give you a set of instructions before sending you home. Once discharged, you should go straight to your home or hotel and rest. You will virtually have no pain apart from a scratchy feeling in the first 4 to 6 hours. Keeping your eyes closed will help relieve this sensation. If you've had LASIK, you'll need to have your eyes checked the following morning. Most people are able to drive without glasses or contacts, and you should be able to return to work that day. If you've had ASLA, the results will be exactly the same as LASIK. However, your recovery will take a bit more time. You'll need to take a few days off work. If SMILE is the procedure recommended for you, it will take a bit longer for your vision to settle, but you should be able to go back to work within a day or 2 of surgery. Following surgery, we ask that you do not go swimming for 2 weeks, avoid contact sports for a month, and no eye makeup for 1 week following surgery. The overwhelming majority of patients who have a laser eye surgery procedure are extremely pleased with the result, and the chance of having serious vision-threatening complications is much less than 1%. However, it's important that you are aware that no surgical procedure is completely risk-free. There are some potential complications that you need to know.
When we do laser vision correction, it's very common that early on after surgery, you'll see some changes in your night vision. It's not a problem, that will settle down, that's just a healing of the eyes. It is very rare now for people to have any kind of change with their night vision because of surgery. In the past it was more common, but with modern lasers, we're able to treat a larger area of the cornea, so night vision problems are actually quite rare and you should just have normal vision. With surgery, we're going to get your eyes in focus. The reason you're doing this is so that you don't need to wear glasses. But we're still relying upon the healing of the eye, and so sometimes the eye will overheal or underheal if you like, And at about 3 months after your surgery, we'll do a final measurement on you, and then we'll decide if we can make the vision even better by doing an enhancement, a fine-tuning. So you'll be seeing well, you'll be seeing without glasses, and you'll think it's good. But when we test you, we may decide we can make it a bit better again and decide to go ahead and do a retreatment and enhancement. That'll happen in less than 5% of people. So you've got a 95% chance that with a single treatment you get the outcome that we're looking for. With surgery, you're doing it so you can function without glasses, but we have to be sure this is safe. And what really we're interested in and concerned about is your best corrected vision, so what you can see when you wear glasses. With modern surgery, the chance of losing any best corrected vision is actually very low. The surgery is very predictable and very accurate, but it is a risk. With this, like any kind of eye surgery. For example, if you had some kind of infection or a lot of inflammation, you may have a bit of scarring in the cornea and you may lose some vision that we can't correct with glasses. And that's extremely rare, but it is still possible, and you need to know about that. When I treat you, I'm making your eyes normal. I'm correcting your vision to make it perfect, really, so it's the same as it should be if you didn't need to wear glasses. That means that you're now like everybody else, and you'll see without glasses, but like everybody else, as you go through the aging process and head towards the age of 50, the natural lens inside your eye will lose its ability to change the focusing of the eye, so you're going to need reading glasses. I had laser surgery about 16 years ago, and I wear reading glasses now sometimes for close vision and small print, and so will you. It's a different part of the eye. It doesn't mean the surgery is wearing off. Your eyes are still in perfect focus, but you can no longer change that focus to look at things up close. So with surgery, with a perfect outcome, you will still go through presbyopia and come to need reading glasses. One of the most common things that will happen to people after surgery that's not good is they'll get dry eye. And at least 1/3 of all patients having laser surgery will get some form of dry eye. You may have heard of dry eye. It's becoming far more common in the public conversation, and it means that your tear film is abnormal. The symptoms of dry eye will be you get some burning, irritation, perhaps some stinging of the eyes, and have to use teardrops. So that after your laser vision correction, there's a high chance you'll need to use teardrops for at least a few weeks after the surgery. Now, we've tested you carefully for dry eye. There's nothing to say you have an increased risk for that, but even with that, you may still need to use teardrops. And very occasionally, people can get quite severe dry eye after surgery. So one of the risks with doing laser vision correction is that you can develop a condition called ectasia. This is really quite uncommon now. But ectasia means that the eye, for some reason, is weaker than it should be. So when we go and do our surgery, we make the cornea a little bit thinner, and we cause a bit of inflammation, which normally doesn't matter at all. The eye can handle that with no problem. But in somebody who is predisposed with an underlying weakness of the cornea, after surgery, there can be a progressive change in the shape of the cornea with changing vision. That's called ectasia. That's a bad complication from surgery and can even require a corneal transplant. So we go to some lengths now to avoid that. We've done a lot of measurements of your eyes before surgery to be sure you're not at risk for that. And we're careful with our surgery to make sure we don't remove too much from the cornea to significantly weaken it. But it is a risk with this kind of surgery. When we do surgery on the eye, including laser vision correction, there's a risk of getting some inflammation afterwards. Inflammation is a normal healing response, and occasionally with laser vision correction the inflammation can be quite pronounced and require extra treatment, but it normally settles with anti-inflammatory drops. For your surgery, there are really two components. There's the creation of the flap, which is removing the surface layer of the cornea to preserve it, and the second laser to reshape the underlying cornea. And these are quite separate things. In creating the flap, it's a very complex thing, really, and it's easy, and you'll lie there and think, well, there's nothing to that, but a lot of things have to be just right. And certainly over the 20 years we've been doing LASIK, there have been problems with creating that flap. It's very uncommon now because we're doing it all with the intralace, and it's a very predictable thing. The most common problem will be that we might have to stop the treatment for some reason and bring you back a few days or a week later and start over again, but that will be less than once a year that would happen. Because the flap is a very thin layer, when we put it back in position on the cornea, we have to be sure that it's perfectly smooth. And sometimes it can get little wrinkles in it. It can move. Maybe you rub your eye after surgery or you do nothing specific, and we check you the day after surgery and see some fine wrinkles in that flap, and we may elect to go back and smooth the flap out. Again, not a very common thing, and if it happens, it's not a problem. We just need to go back and smooth it out.
Although the vast majority of people who seek laser vision correction procedure are suitable, around 1 in 5 people are not suitable for the procedure. It's reassuring to know that we practice what we preach. Our own family, friends, staff, and even our doctors have had the very same laser procedure on their own eyes with excellent results. Here at Vision Eye Institute Bondi Junction, our goal, along with yours, is to help you achieve freedom from glasses or contact lenses and make the procedure as safe and successful as possible.